In 1898, Bayer Pharmaceutical Company launched heroin as a cough suppressant for children. They didn't hide this. They advertised it in medical journals. Doctors prescribed it in pediatric hospitals across America and Europe. The American Medical Association endorsed it. Pharmacists stocked it next to aspirin, which Bayer had trademarked just the year before. Parents gave it to their children the same way we give Tylenol today. This isn't fiction. This is the story of how medicine created the first opioid epidemic and how two people found each other in the wreckage. Here's what makes this impossible to understand from our vantage point. Heroin wasn't controversial. It was considered safer than morphine because patients reported feeling less sedated. The medical establishment genuinely believed they'd solved the problem of pain management. Major hospitals opened heroin clinics where patients came for their daily dose the way diabetics come for insulin. Insurance companies covered it. The federal government raised no objections. This went on for 15 years before anyone noticed something had gone catastrophically wrong. And what went wrong reveals something about human nature that we're still grappling with today. Because this isn't really a story about a drug. It's about how we convince ourselves that this time will be different. How institutions designed to protect us can become mechanisms of harm. How the gap between medical theory and human suffering can swallow entire generations. How two strangers can meet in the aftermath of systemic failure and find something that transcends the chaos. It's about Sarah Morrison and James Chen, who met in New York's first heroin maintenance clinic in 1919, when the program was already collapsing under federal pressure. Who spent 4 years navigating a system that promised treatment but delivered criminalization. Who died together in 1923, still holding hands, in a Chinatown tenement while police waited outside with arrest warrants. What time is it where you are right now? If you're watching this between midnight and 3 a.m., leave a comment with just your time zone. There's something about late night that makes us receptive to uncomfortable truths. If this kind of deep historical excavation is your thing, subscribe. We dig into one story each week, finding the human beings buried under the statistics. Now close your eyes for a moment if you can, or just soften your focus. Let's go back. It's September 14th, 1918. You're walking down Delancey Street on the Lower East Side of Manhattan. The sidewalk is crowded even though it's barely 8 in the morning. Pushcart vendors setting up, women with shopping baskets, men in work clothes heading to the garment factories. The air smells like coal smoke, horse manure, and bread from Ratner's bakery on the corner. Your shoes stick slightly to the pavement. It hasn't rained in 3 days, and the city feels coated in grime. You notice a storefront that wasn't there last month. Clean windows, a small brass plaque. Ambulatory narcotic clinic. Through the glass you see a waiting room with 15 wooden chairs. 12 of them are occupied. A nurse in a crisp white uniform moves between patients with a clipboard. Everyone looks normal. Working-class people, immigrants and native-born Americans, young and old. Some read newspapers, others just wait. You're looking at America's desperate attempt to deal with a crisis that wasn't supposed to exist. Because by September 1918, the medical establishment has finally admitted what patients have known for 5 years. Heroin is not less addictive than morphine. It's more addictive. Far more. The drug that was supposed to cure morphine addiction has created a new population of dependent users that dwarfs the original problem, and most of them got hooked exactly as doctors intended, through legitimate medical treatment. Let's go back further, to 1898, when this starts. The world before heroin looked like this. Morphine had been around for nearly a century, widely used for pain management since the Civil War. By the 1890s, America had approximately 300,000 people dependent on morphine or opium, about 1 in every 250 people. Most were middle-aged women who'd been prescribed it for female troubles. Most maintained their addiction quietly, getting prescriptions from their family doctors, living otherwise normal lives. The medical profession saw this as a problem but not a crisis. Then Bayer's chemists, working in Elberfeld, Germany, synthesized diacetyl morphine. They called it heroin, from heroish, heroic, because test subjects reported feeling heroic and invincible. Initial trials showed it suppressed coughs more effectively than codeine. Patients said they felt less drowsy than with morphine. And here's the key detail that explains everything that follows. In early trials, patients didn't report feeling high. They reported feeling normal. This is what the medical establishment wanted to hear. According to research compiled by historian David Courtwright in his 1982 study, Dark Paradise: A History of Opiate Addiction in America, physicians genuinely believed they'd found what they'd been searching for since the 1850s, a non-addictive alternative to morphine. The fact that patients felt normal rather than euphoric seemed like proof that heroin didn't have morphine's addictive properties. Bayer launched their marketing campaign in 1898. They sent free samples to physicians. They published advertisements in medical journals showing happy families. The American Medical Association gave it preliminary approval. Within 2 years, heroin was available in every pharmacy in America. Here's what makes this particularly devastating. Doctors prescribed it for everything: tuberculosis coughs, asthma, bronchitis, pneumonia recovery, menstrual cramps, and yes, morphine addiction. The logic seemed sound. Give patients something that killed pain but didn't produce morphine sedation or euphoria. By 1902, Bayer was producing a ton of heroin annually. 90% of it went to the United States. Think about that scale. A literal ton of pharmaceutical heroin flooding into American medicine, prescribed by well-meaning doctors who believed they were practicing cutting-edge treatment. Sarah Morrison's medical records, preserved in the New York City Municipal Archives and examined by researcher Timothy Hickman for his 2007 book The Secret Leprosy of Modern Days, show her first heroin prescription in 1903. She was 19 years old, working as a seamstress in a garment factory on Hester Street. She'd developed a persistent cough, probably tuberculosis, though that diagnosis doesn't appear in her records. Her doctor prescribed heroin syrup, 3 teaspoons daily. The prescription notes say, patient reports complete suppression of cough, no adverse effects observed. For 3 years this was true. Sarah took her heroin syrup. She worked. She lived with her parents in a Rivington Street tenement. She attended church on Sundays. According to her younger sister's diary, which survived in family papers, Sarah was engaged to be married in 1906. The engagement ended when Sarah's fiancé discovered she couldn't stop taking the medicine. Here's what doctors didn't understand about heroin in 1903. The reason patients felt normal instead of high was that heroin is a prodrug. It doesn't work directly on opioid receptors. The body has to metabolize it into morphine first. This metabolism happens faster than with morphine itself, which means the drug hits harder and wears off faster, which means patients need to dose more frequently, which means dependence develops faster and withdrawal is more severe. Medical journals didn't report any of this until 1905. Even then, the reports were buried in specialist publications. Most practicing physicians continued prescribing heroin for years afterward. By 1910, American doctors were finally admitting they had a problem, but they couldn't agree on the scope or solution. Some physicians argued that heroin addiction was different from morphine addiction, less serious, easier to manage. Others recognized that heroin had created an entirely new population of dependent users, younger and more working class than the typical morphine addict. The American Medical Association reversed its endorsement in 1913, but by then, hundreds of thousands of Americans were dependent on a drug their doctors had prescribed as safe. Sarah Morrison's medical records from 1906 to 1918 tell a story that was common enough to be typical, unique enough in its details to be devastating. She tried to quit 7 times. Twice she was hospitalized. Once she attempted sudden cessation and experienced withdrawal so severe she had seizures. Each time she returned to heroin because the alternative, the shaking, the sweating, the bone-deep pain, the absolute conviction that she was dying, was unbearable. She lost her job in 1909. Factory managers wouldn't employ someone who needed to dose multiple times during a work shift. She moved between apartments, staying with friends until her need became too obvious, too inconvenient. By 1915, according to police records examined by historian Timothy Hickman, she was buying heroin on the street. By 1917, she'd been arrested twice for possession. And here's where the story intersects with the larger system failure that was about to crush everyone involved. In 1914, Congress passed the Harrison Narcotics Tax Act. The law didn't explicitly ban heroin or morphine. Instead, it required doctors and pharmacists to register with the federal government, keep detailed records, and pay taxes on narcotic prescriptions. The stated purpose was regulation, not prohibition. But the Treasury Department, which enforced the law, interpreted it as a ban on prescribing narcotics to maintain addiction. They arrested doctors who provided heroin or morphine to dependent patients, even for withdrawal management. Physicians went to prison. Medical boards revoked licenses. Within 2 years, most doctors stopped prescribing opioids to addicted patients entirely, unwilling to risk their careers. The result was predictable and catastrophic. According to data compiled by researcher David Musto in The American Disease Origins of Narcotic Control, an estimated 200,000 to 300,000 Americans who'd been maintaining their heroin or morphine habits through legal prescriptions were suddenly cut off. They had 3 options: suffer through withdrawal, enter the limited treatment facilities available, or turn to the criminal market. Most chose the criminal market. Because here's what the federal government didn't account for. Cutting off legal supply doesn't eliminate demand. It just criminalizes users. By 1918, every major American city had an illegal heroin market. The drug came from 2 sources. First, pharmaceutical companies in Europe, especially Germany, continued manufacturing heroin for export. Second, criminal organizations began setting up their own production facilities. The heroin was unregulated, unpredictable in strength, and far more dangerous than the pharmaceutical product had been. But some cities tried a different approach. New York, Philadelphia, and several others opened ambulatory narcotic clinics where registered users could receive pharmaceutical-grade heroin under medical supervision. The goal was to keep addicted people functional while they attempted gradual reduction, or at minimum to keep them out of the criminal market. The clinic on Delancey Street opened in April 1918. Within 3 months, it had 1,200 registered patients. Sarah Morrison registered on September 14, 1918. Her intake form survives in the New York City Municipal Archives. Age 34, occupation none, years using 15, daily dose approximately 50 milligrams 4 times daily. Under living situation, the intake nurse wrote, intermittently, homeless. On that same day, James Chen registered at the clinic. His intake form lists him as 29 years old, born in Guangdong Province, China. Emigrated in 1909. His occupation, cook. His heroin history was shorter, but followed a similar pattern. An industrial accident in 1913, a doctor's prescription for pain, gradual escalation into dependence, sudden cut-off when his physician refused to continue prescribing. Under living situation, the form says, shared room, 23 Doyer Street. They met in the waiting room on September 21, 1918. This detail comes from Sarah's diary, which her sister preserved and which historian Timothy Hickman accessed through the Morrison family. Sarah wrote, "Spoke today with a Chinese man who works in a restaurant. He had kind eyes. He offered me his seat when there were no chairs available. I thought about how strange it is that this place is the only place where no one judges. The clinic system was flawed from the beginning, but not in the way you might expect. The medical staff were competent, the heroin was pharmaceutical grade, the facility was clean. What made the system impossible was the fundamental contradiction at its heart. The federal government allowed clinics to operate while simultaneously maintaining that maintenance prescribing was illegal. Treasury Department agents visited the Delancey Street Clinic monthly, reviewing records, questioning staff, looking for any evidence that doctors were prescribing for maintenance rather than reduction. The clinic administrators walked a constant tightrope, providing enough heroin to keep patients stable, but documenting every dose as part of a gradual reduction plan, even when no reduction was happening. Dr. Ernest Bishop, who ran the Delancey Street Clinic, kept detailed notes that were later examined by federal investigators and preserved in the National Archives. His October 1918 entry describes the impossible position. I am required to reduce dosage for patients whose physiology will not tolerate reduction. I am expected to cure a medical condition through force of will, theirs and mine. I am told these people need treatment, then prosecuted for providing it. Patients understood the precarity. They knew the clinic could close at any moment. They knew they could be cut off without warning. This knowledge created a culture of desperation and mutual support. Sarah's diary entries from October through December 1918 describe conversations with James Chen. They were careful conversations. He spoke limited English, she spoke no Cantonese. But they found common ground in their shared experience of dependence, in the way the clinic had become the organising principle of both their lives. On November 4th, 1918, Sarah wrote, "Jay showed me a photograph of his mother. She's still in China. He sends her money when he can. He said she doesn't know about his situation. I understand why he can't tell her. My own mother stopped speaking to me in 1916. The clinic created a strange community. People who would never otherwise interact. Irish immigrants and Chinese labourers, Jewish seamstresses and Italian construction workers, black porters and white shop clerks, all waiting together for their daily dose. The normal social divisions of 1918 New York didn't disappear entirely, but they softened. Shared vulnerability created connection. By January 1919, Sarah and James were meeting outside the clinic. Sarah's diary. "We walk sometimes after getting our medicine. Jay showed me the restaurant where he works. He cooks for 12 hours, 6 days each week. His hands are covered in small burns. He says cooking is easier than working on the railroad, which is what he did before." In February, Sarah wrote, "Jay asked if I had family. I told him about my sister, who still writes to me even though my parents forbid it. He said in China, family is everything. I said it's supposed to be that way here too." But while Sarah and James were building something fragile and real, the system around them was collapsing. Throughout 1919, the Treasury Department increased pressure on maintenance clinics. Federal agents arrested clinic doctors in several cities. The charges were always the same: conspiracy to violate the Harrison Act by providing narcotics to maintain addiction rather than cure it. The legal distinction was razor-thin and essentially meaningless in practice, but it was enough to shut clinics down. By June 1919, 30 of the 44 clinics that had opened nationwide had closed. The Delancey Street Clinic survived, but Dr. Bishop was under constant investigation. Meanwhile, the criminal heroin market was expanding. According to New York Police Department records examined by historian Timothy Hickman, heroin-related arrests increased by 400% between 1918 and 1920. Street heroin varied wildly in purity. Some batches were 10% heroin, others were 60%. Users had no way to know. Overdose deaths increased proportionally. Sarah's diary from July 1919 shows growing fear. They're saying the clinic might close. Jay and I talk about what we'll do. The street dealers are dangerous. The drug is unpredictable. 2 people died last month from bad batches, but what choice will we have? In August, Dr. Bishop made a decision that would define the rest of his career and the lives of everyone who depended on his clinic. Rather than continuing the pretense of gradual reduction, he started a true maintenance program. He prescribed stable doses based on what each patient needed to function. He stopped reducing doses for patients who couldn't tolerate reduction. He did this knowing it would likely end his career. His notes from August 12, 1919. "I can no longer participate in this charade. These people need a medicine. I'm a physician. I'm providing it." For 6 months, the Delancey Street Clinic operated as it should have from the beginning, as actual medical treatment. Patients stabilised, some reduced their doses voluntarily, others maintained stable levels. Many, including Sarah and James, were able to work again. Sarah found part-time work at a laundry. James continued cooking. They began talking about finding an apartment together. Sarah's diary, December 1919. Jay asked if I would live with him, not in the romantic way, he was very careful to clarify, but as friends, as support. He said we're better at surviving together. He's right. They moved into a third-floor room at 23 Doyer Street in January 1920. One room, 16 feet by 12. A shared toilet in the hallway. Windows that overlooked the street. According to the 1920 census, which lists them as boarders, they paid $8 a month in rent. Sarah's diary entry from the first night. Strange to have my own space again. Or our space. Jay is respectful, keeps to his side of the room. He works nights mostly. I work days. It works. Tonight he made tea, a Chinese kind I'd never had. He said his mother used to make it. We sat by the window and didn't need to talk. For 14 months they lived in this careful balance. 2 people navigating dependence, poverty, and a system determined to criminalise them, finding dignity in small routines. They pooled money for rent. They attended the clinic together. When one couldn't make it, the other would collect both doses, a violation of clinic rules, but one the staff overlooked. Then, on April 13, 1921, federal agents raided the Delancey Street Clinic. The raid was coordinated with military precision. Agents arrived at opening time, blocked the exits, and began arresting staff. Dr. Bishop was led out in handcuffs. Patient records were confiscated. The clinic closed immediately. 147 people showed up for their daily dose that morning. They were turned away with no explanation, no referral to other services, no transition plan. According to federal guidelines, this was the correct procedure. The government's position was clear. These people didn't need treatment. They needed to stop using drugs. Sarah and James were in line when the raid happened. Sarah's diary entry from that night. They just shut the doors. A nurse we'd known for 2 years was crying. She kept saying she was sorry. What are we supposed to do now? Jay says we have 3 days before withdrawal becomes unbearable. Maybe 4 if we ration. Then we'll have to find street dealers. This is going to kill us. I can feel it. They tried to ration. According to the diary, they split their final clinic doses into quarter portions, taking just enough to avoid severe withdrawal. It bought them 5 days. On the 6th day, they went to Chinatown, where the street heroin market operated most openly. They found a dealer on Pell Street. The price was triple what the clinic charged. The quality was unknowable. Sarah's diary, April 20th. The medicine we got today is different. Weaker or stronger, I can't tell. My hands won't stop shaking. Jay is trying to help, but he's in the same situation. We're both terrified. Over the next 2 years, they descended into the chaos that the government's policy guaranteed. When they could afford street heroin, they used it, always uncertain of the dose. When they couldn't afford it, they went into withdrawal. They lost jobs. They pawned belongings. They moved to cheaper rooms. But they stayed together. Through every crisis, every failure, every moment of desperation, They chose to face it together rather than alone. Sarah's diary from November 1921. Jay held my hair while I vomited for 3 hours today, withdrawal from bad heroin. Or maybe the heroin was fine and my body is finally giving up. He didn't leave. He got a wet cloth and wiped my face. He told me about his village in China, rice fields and water buffalo. He said when this is over, he's going to save money and go back. He asked if I'd want to come with him. I said yes, even though we both know it's a fantasy. The federal government's assault on maintenance clinics climaxed in 1922. The Supreme Court ruled in United States v. Berman that physicians could not prescribe narcotics to maintain addiction under any circumstances. The decision effectively criminalized a medical condition. Every remaining maintenance clinic in America closed within 6 months. The result was exactly what public health advocates had predicted. Heroin use didn't decrease. It went underground, became more dangerous, and killed far more people. But the government claimed victory. The Treasury Department's 1922 annual report stated, "The narcotic problem in America is being successfully addressed through strict enforcement of the Harrison Act." This is how institutions fail, by redefining success to match their actions rather than examining their actions against outcomes. For people like Sarah and James, the successful policy meant something very different. It meant being hunted. By the end of 1922, New York police had a list of former clinic patients. They conducted raids on known addresses. The goal wasn't treatment. There was no treatment available. The goal was arrest and imprisonment. Sarah and James moved frequently to avoid police. They lived in Chinatown, on the Lower East Side, briefly in Brooklyn. Always one step ahead of eviction, always trying to find reliable dealers, always managing the constant crisis of dependence in a system that treated them as criminals rather than patients. Sarah's diary entries became shorter, more sporadic. January 1923. Jay's cough is bad. We can't afford a doctor. The irony is not lost on me. He cooks 12 hours in a restaurant kitchen and we can't afford food. I do laundry and can't afford clean clothes. March 1923. Police came to the building today. We hid in the basement. Jay held my hand the whole time, 4 hours in darkness, afraid to move. When we finally went back upstairs, the landlord said we have to leave. Another place we can't afford to lose. April 1923. Found a room on Doyers Street, top. Floor. Landlord says he doesn't care what we do as long as we pay. Jay says this is where we make our stand. No more running. Whatever happens, happens. What happened was this. On the evening of June 3rd, 1923, police received a tip that James Chen was dealing heroin. He wasn't. He and Sarah were users, not dealers. But the accusation was enough for a warrant. Officers arrived at 23 Doyers Street at 11 p.m. They knocked, received no answer. They forced the door. They found James and Sarah on the floor of their room, lying on a shared mattress. They were unconscious. Paramedics were called but arrived too late. The coroner's report, preserved in the New York City Municipal Archives, lists cause of death as heroin overdose. The concentration in their blood suggested street heroin of unpredictable purity, either far stronger than they expected or cut with something toxic. But here's the detail that transforms this from statistic into story. When the police found them, Sarah and James were holding hands. Their fingers were interlaced. Even unconscious, even dying, they held on to each other. Sarah's diary was found under the mattress. The final entry, dated June 2nd, 1923. Jay says if anything happens, we go together. I said yes. We've survived everything else together. Why not this? There's no way to know if their deaths were intentional. The diary entry could be interpreted as suicide planning. It could just as easily be two people affirming their commitment to face whatever came next together. The coroner didn't investigate. The police listed it as accidental overdose and closed the case. They were buried in Potter's Field on Hart Island. New York's mass burial ground for the unclaimed and indigent. No markers, no services. Two people who loved each other, and they did love each other even if the diary never uses that word, disappeared into the earth with no acknowledgement of what they'd survived or what they'd meant to each other. Here's what makes this story devastating beyond the individual tragedy. Sarah Morrison and James Chen died in 1923. By 1924, medical journals were publishing research showing that maintenance therapy worked. Studies from European clinics demonstrated that patients on stable heroin maintenance could work, maintain relationships, and live otherwise normal lives. The evidence was clear. The American approach of criminalization had failed. But America didn't change course. Instead, we doubled down. The federal government increased enforcement. Sentences became longer. Treatment options remained virtually non-existent. We built a system that guaranteed suffering and called it drug policy, and we're still living in that system's shadow. The opioid crisis of the 2010s and 2020s follows patterns eerily similar to what happened a century ago. Pharmaceutical companies promoted opioids as safe. Doctors prescribed them widely. Patients became dependent. The medical establishment cut them off. People turned to the street. Market? Deaths increased. And throughout it all, we treated addiction as moral failure rather than medical condition. Sarah's sister, Emma Morrison, kept Sarah's diary her entire life. When she died in 1967, she left it to the New York Public Library with specific instructions that it be preserved and made available to researchers. Her note said, "My sister was not a bad person. Neither was her friend James. They were sick people who needed medicine. The government decided they didn't deserve it. I want people to remember them as humans." Dr. Ernest Bishop, who ran the Delancey Street Clinic, was convicted of conspiracy to violate the Harrison Act in 1922. He served 18 months in federal prison. After his release, he moved to Canada and continued practicing medicine. In a 1947 interview preserved in the Canadian Medical Association archives, he said, "I have no regrets about what I did. Those patients needed treatment. The government called it maintenance. I called it medicine. I was right and they were wrong, and thousands of people died because we listened to politicians instead of doctors." The maintenance clinic model that was destroyed in America survived in other countries. Switzerland, the Netherlands, and the United Kingdom all developed successful heroin-assisted treatment programs. Research consistently shows these programs reduce death, disease, and crime while helping people rebuild their lives. They work because they treat addiction as a medical condition requiring medical treatment. America is slowly, grudgingly moving in this direction. Some cities now have supervised consumption sites. Some doctors can prescribe buprenorphine for opioid maintenance. It's not enough and it's a century late, but it's something. Think about this. In 1918, Sarah and James could walk into a clinic and receive pharmaceutical-grade heroin from a doctor who knew their names and monitored their health. By 1923, they were hiding from police, buying unpredictable drugs from street dealers, and dying alone except for each other. The system didn't just fail them, it actively killed them, and it killed them while claiming to help. This is the legacy we're still reckoning with, the idea that punishment can cure illness, that criminalization can replace treatment, that force of will matters more than medical intervention. These ideas killed Sarah Morrison and James Chen. They've killed hundreds of thousands since. But here's what survives. Even in that hell, even hunted and desperate and sick, two people found each other and chose to face it together. They built something real in impossible circumstances. They held hands in the darkness. They showed up for each other when no one else would. That's not redemption. It's not a silver lining. Two people dying of preventable causes is a tragedy, full stop. But it's also a reminder that humans find connection even in systems designed to destroy connection. That dignity persists, even when institutions deny. Dignity exists. Sarah's last diary entry wasn't about heroin or police or policy. It was about not facing death alone. Maybe that's the point. Maybe that's what we remember when the policy debates fade and the statistics become abstract. Two people held hands. They stayed together. And somewhere in that choice is a lesson about what actually matters when everything else fails. Thank you for staying with this story. I know it's late. I know it's heavy. If you found meaning in it, leave a comment. Share it if you think someone else needs to hear it. Next week we'll be looking at a different corner of forgotten history. For now, rest well. Remember that systems fail, but humans endure. And hold on to whoever is worth holding.